Hi, welcome to another exciting week with Smart Acids. This week we're going to talk to you about Tay-Sachs disease. Unfortunately, this is a genetic disease that cannot be prevented. It's most common in children of no specific gender. Typically, the child will be diagnosed with it at about 3 to 6 months, and they will unfortunately pass away around 4 to 5 years. Some signs and symptoms are deafness, progressive blindness, decreased muscle strength, increased startle response, paralysis, seizure, muscular stiffness, delayed mental and social development, slow growth, red spot on the macula of the eye. And if your child has a seizure or has trouble breathing, call 911 immediately, as this could be very life-threatening.
Oh hey, I was just reading about the Tay-Sachs disorder. One fun fact about it is that it's most commonly found in people of the Ashkenazi Jewish descent. However, this disease is not gender specific. It is age specific. We find it in infants, typically between the ages of 3 to 6 months, when they develop slow muscles and weakness in their movement. How would we diagnose this disease? Let's see. Affected infants lose motor skills, such as turning over, sitting, and crawling. They also develop an exaggerated startle reaction to loud noises.
Ah!
Whoa! Yeah, kind of like that. As the disease progresses, children with this disease experience seizures, vision and hearing loss, intellectual disability, and paralysis. An eye abnormality called a cherry red spot, which can be identified with an eye examination, is a characteristic of this disorder. And children with this severe infantile form of Tay-Sachs disease usually live only into early childhood.
So what is the treatment for Tay-Sachs? There is no cure for Tay-Sachs. The goal of the treatment is support and comfort. There are prescription medications, including seizure medications. Children with this disease are at high risk of lung infections that cause breathing problems and frequently accumulate mucus in their lungs. Respiratory therapists reduce mucus using chest physiotherapy. Sometimes a feeding tube is used so children with respiratory problems do not accidentally inhale their food and choke. So let's talk about the enzyme involved. Basically, Tay-Sachs is a progressive destruction of the nervous system because of the absence of hexoaminidase, or Hex-A. Basically, a fatty substance called GM2 accumulates in the nerve cells and the brain, and the ongoing accumulation causes progressive damage to the cells. So basically, this disease is not preventable because it's